This is Mrs. Nugent. We're going to start with chapter 1, which is nursing today. We'll be talking today about nursing and the healthcare environment. So what is nursing? I'd like for you guys to kind of spend some time thinking about this. Even if you wanted to email me with what you think nursing is, I would love to know what you think. But in our book, it'll tell us that the American Nurses Association definition, I'm going to read this word for word for you guys. Nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, communities, and populations. So what do you think about that definition? Your book will also tell you the first sentence actually in your textbook is nursing is an art and a science. What does this mean? How is nursing an art? How is it a science? So what I'm going to tell you is that I think it's often easy to think about what is nursing as a science. However, nursing as an art, we really have to think about that one. But I feel that nursing can be very creative in the way we plan our care and implement our care for our patients. And that's where that art comes in. Nursing is a profession. So what's the difference between a profession and a job? Okay, there are some items that you need to know that separate a profession from a job. And nursing is not just a job, it is a profession. So nursing is a profession because we share the characteristics of a profession, which are extended education, our own body of knowledge, code of ethics, autonomous nature. So let's go over those. Extended education. So an entry-level ADN, then you can progress to a BSN, a master's degree, advanced practice RN, and doctoral degree. RNs are also required to obtain continuing education credits to renew their license. Nursing requires a body of knowledge, and it's different from other jobs or professions. Nursing has a code of ethics, which is the physiological ideals of right and wrong. It's the philosophical ideas of right and wrong. So a code of ethics will guide our practice. The ANA has a number of publications that address ethics and human rights in nursing. In fact, we have a whole chapter designated for this. You will have autonomy in decision making and practice as a nurse. This involves the initiation of nursing interventions without medical orders. But remember, you will also be held responsible professionally and legally for the type and quality of nursing care provided. Professionally, we can lose our license, our nursing license, and legally, we can be sued for malpractice. Used to be that doctors were the only ones that were sued for malpractice, but now nurses can be sued as well. So I want to reference some pages, and I'll do this intermittently throughout, where I'll tell you a page, and you can kind of jot that down and look at it later. So on page 2, I do want you to pay attention to and go back and look at box 1-2. These standards of care, the nursing process, will guide the care you render to your patients in all healthcare facilities. Implementation includes coordination of care, health teaching, and health promotion, consultation and prescriptive authority in treatment. The standards of practice describe a competent level of nursing care. These levels of care are demonstrated by the critical thinking model known as nursing process model, which includes assessment, diagnosis, outcomes identification and planning, implementation, and evaluation. Make sure that you start to really think about these 6 standards of practice. This would be your nursing process model. So it's actually a systematic approach and not a theory. Make sure that you understand that. And just kind of start committing to memory this model. So these standards of care, again, Make sure you understand they guide our practice. Also, take a look at page 228. Those are nursing diagnoses. We have a whole chapter that we discuss nursing diagnoses, but I do like to first thing start out by telling you to take a look at page 228 where it has a list of nursing diagnoses. So you can kind of start looking and thinking in that direction. Implementation includes coordination of care, health teaching, health promotion, consultation, and prescriptive authority and treatment. What's the difference between what a non-licensed assistant, a practical nurse, and an RN can do? Right here, I want to kind of interject a little bit about your textbook. If you'll pay close attention, there are yellow pages in different chapters. Those yellow pages are great for helping you to know who and what you can delegate care. Important for us to think about. Okay, so just remember too that even if you do designate a task, you remain responsible as the RN. And as the RN, you're the only one that can assess, teach, or evaluate. So this slide talks about different professional roles. A caregiver. If a nurse is acting as a caregiver, nurses help their patients regain health and find their maximum level of independent function through the healing process. Healing involves the body, mind, and spirit. An advocate. Nurses protect the human and legal rights of their patients and help patients assert those rights when needed. She supports, protects the patient. Educator. Your teaching can be formal or informal and will involve the patient, family, significant other, or other support systems. Communicator. Communication is essential for all nursing activities. You'll communicate with patients, families, other nurses, and healthcare professionals, and the community. Miscommunication is the source of many healthcare errors. As a manager, need to make sure that safe, quality care is provided in an efficient manner. So I'd like to know what goals you have as far as, what area of nursing do you want to go into? If you want to just send me a note about that, I would love to get to know you and get to know, what area you're thinking about going into. So, career goals within nursing could involve staff nurse in a med-surg, OR, PACU, ED, short stay unit, ICU, CCU, TCU, OB, PEDS, or L&D, or in outpatient setting. Advanced practice nurse requires additional education and experience. APNs can be nurse practitioner, clinical nurse specialist, a certified registered nurse anesthetist, or a certified midwife. A nurse practitioner provides health care to patients who are healthy or who have chronic conditions, more holistic approach than physicians. Clinical nurse specialist would be an expert clinician in a specialized area of practice. Certified registered nurse anesthetists work under the guidance and supervision of an anesthesiologist. Certified nurse midwives provide independent care for women during normal pregnancy, labor, and delivery, and care for the newborn. Also, some routine gynecological services. Nurse educator requires additional education and experience. They can work in nursing programs, staff development, or could be like a certified diabetes educator or even an ostomy care nurse. A nurse administrator requires additional education and experience. For example, MHA is a master's degree in hospital administration, which involves budgeting, staffing, employee development, and evaluations. Nursing researcher, usually you're going to work in an academic setting or hospital and conduct evidence-based practice and research to improve nursing care. So Florence Nightingale is actually our mother of nursing. Nursing responds to healthcare needs of society, which are influenced by economic, social, and cultural variables of a specific era. Florence Nightingale believed that the role of nurses was to help the body recover and then remain free from disease. Nightingale was the first practicing epidemiologist, as an epidemiologist, she analyzed what causes disease and outbreaks. She used her keen mind and statistical analysis to show the connection between poor sanitation and diseases like cholera and dysentery. In 1860, Florence organized the first school of nursing, the Nightingale Training School for Nurses at St. Thomas Hospital in London. Known as the Lady with the Lamp, Nightingale crossed the battlefields of the Crimean War with her lantern. By improving sanitation in battlefield hospitals, she showed how effective fresh air, hygiene, and nutrition were in the treatment of wounded soldiers. The practices she advocated remain a basic part of nursing care in the 21st century. Compassion fatigue, secondary trauma, stress, and burnout impact the health and wellness of nursing and the quality of care provided to patients. When healthcare agencies develop interventions to manage these issues, nurse retention and job satisfaction rates improve. All nurses require coping skills to better manage the stressors. Interventions in the healthcare agency alone are not enough. The Affordable Care Act affects how healthcare is paid for and delivered. There will be greater emphasis on health promotion, disease prevention, and illness management in the future. More nursing services will be community-based care settings. As a result, more nurses will be needed to practice in community care centers and in schools and senior centers. This will require nurses to be better able to assess for resources and help patients adapt so as to be able to safely return to their community. Skyrocketing healthcare costs present challenges to the nursing profession, consumer, and healthcare delivery system. As a nurse, you're responsible for providing patients with the best quality care in an efficient and economically sound manner. So what type of changes affect healthcare? Well, such changes such as people moving from rural to urban centers, increase in the population over 65, increase in patients living with chronic and long-term illness. Unemployment, underemployment, and low-paying jobs, mental illness, homelessness, and rising healthcare costs all contribute to increases in the medically underserved population. In addition, the number of underserved patients who require home-based palliative care service is increasing. Nurses have always cared for patients inside and outside of the medical system. We promote the rights of minorities, immigrants, and the underserved, and the uninsured to receive high-quality health care. To prevent the threat of terrorism, the nursing curriculum and healthcare agencies are training future and practicing nurses to deal with nuclear, chemical, and biological events. In the United States, individual state boards of nursing oversee nurse practice acts. The Nurse Practice Acts regulate the scope of nursing practice and protect public health, safety, and welfare. They also specify the training needed for nurse practitioners and other advanced practice professionals. Licensure, the RN candidate must pass the NCLEX RN, a standardized examination for all candidates. It's proof of minimum knowledge for a new graduate. Certification, expertise in a specific area of nursing practice. Common certification is for Med-Surg nurse, diabetic nurse educator, clinical care nurse, and many more. You'll begin to learn how to develop your critical thinking abilities and your ability to practice autonomously. You will gradually acquire clinical expertise. Again, another page I want you to reference is page 2 of your text, box 1-1. Very important that we understand Patricia Benner and Patricia Benner has done extensive work on the development of proficiency of nurses. These are the phases: novice, advanced beginner, competent, proficient, and expert. The novice would be like a beginning nursing student or any nurse entering a situation in which there is no previous level of experience. Transfer to a new area of nursing and you're a novice. Advanced beginner is a nurse who has had some level of experience with the situation. Competent is a nurse who has been in the same clinical position for 2 to 3 years. A proficient nurse is a nurse with more than 2 to 3 years of experience in the same clinical position, focuses on managing care as opposed to managing and performing skills. And then the expert is a nurse with diverse experience who has an intuitive grasp of an existing or potential clinical problem. And if you ever get the chance to work with an expert, it is truly amazing. As you progress, you'll understand that you can use your intuition. An expert nurse can use her intuition to grasp an existing or potential clinical problem. Now, our PowerPoints will have quiz questions at the end that we'll review, and I'll try to pause, or maybe you want to pause the PowerPoint to formulate your own answer, because I'm going to give the answers as well. Nursing is defined as a profession because nurses, it is, number 2, practice autonomy. We do perform specific skills, but here we're talking about the profession. We utilize knowledge, no. From the medical discipline, we do not. We do, our services are charged for. However, we don't particularly charge a fee for services rendered. Career options for a nurse to become an advanced practice registered nurse include which of the following? And this is one of those that is select all that apply. And the answer is number 2, 3, and 4. The 4 roles of APRNs include these and certified nurse practitioner. Physician assistant is not a nursing role. If the nurse decides to choose a career as a critical care nurse, then his specialty is identified by which means? The answer is setting. The CNS specialty may be identified by a population, for example, geriatrics, a setting, which is critical. An example would be critical care, a disease specialty, for example, diabetes, a type of care, for example, rehabilitation, or a type of problem, for example, pain. By choosing critical care, the nurse's specialty would be identified by setting.